I think a really big, powerful bet is in completely rethinking about what healthcare is in India, and in understanding that India has the capability, because of its unique nature, because of its population, to shape global healthcare.
A really big powerful bet is in completely rethinking about what healthcare is in India and understanding that India has the capability to shape global healthcare. This is what Rahul Gandhi said after releasing the Congress manifesto for the 2019 Lok Sabha election. The Right to Health program of Congress is based on the spiritual outlook of the Indian cultural heritage. The scheme will bring relief to 130 crore people with its promising free medical treatment. The scheme, which was originated in Kerala, has a totally different approach from that of the major healthcare schemes, which is based on the insurance industry, all around the world. It is widely propagated that insurance is the only way to ensure the health, welfare and safety of 130 crore people in India. This viewpoint is supported by the government officials and the political leadership. There is a need for widespread awareness and protest against these trends. Rahul Gandhi deserves to be honored for the totally different approach on healthcare scheme to all Indians. The new proposal offers a new direction to the global health sector and open a fresh perspective to resolve international healthcare concerns. Through his approval of the plan, Rahul Gandhi has given a clear vision for the world health sector. Although Right to Health was firstly announced in the 2014 Lok Sabha manifesto, an accurate indication as to how should it be implemented was given in the Congress-led UDF manifesto of 2016 Kerala Assembly election. This scheme suggests the government should provide financial aid for basic recurring expenses incurred by the hospital. Basic recurring expenses are staff salary, equipment maintenance costs and replacement costs. UDF promised to reduce the patient medical expenses by 1/30 or 3.33% excluding room rent and medicine. UDF has offered medical insurance scheme to meet those expenses, which are to be met by patients. However, the Congress national leadership has decided that it would be better to bear even those expenses, i.e., expenses are to be met by the patients can be met by the government itself. Accordingly, in the 2019 Lok Sabha manifesto, free treatment was offered to all in government hospitals and selected private hospitals. In 2020, when the Tata Group built a 540-room hospital at Kasaragod in Kerala at the cost of 60 crore to the time of COVID crisis, the initiative of the Tata Group has thus proved that the new health proposal scheme be practical in India. The Kerala government provided the hospital equipment and undertook the management of the hospital. This partnership between public and private sector is the essence of the Congress's Right to Health concept. If the government allows the Tata Group to collect the room rent from the patients directly, the UDF election manifesto no bill hospital be materialized, since the Tata Group has been an established company in the hospitality sector. They have no intention to levy more fees from the patients for unnecessary surgery or treatment. In short, the UDF no-bill hospital is the culmination of the program proposed by 2019 Lok Sabha manifesto.
It was in 2011 that Kumbhanad Valley Il Santosh V. George explained to Malayalam Manorama editorial director Thomas Jacob
about the right to health concept in detail. This was discussed in the Tomorrow Kerala Idea Fellowship held in Kochi
in 2013 by Malayalam Manorama.
For the first time in India, the then Chief Minister Ummenchandi demanded that health should be a right. What is special in the scheme is the avoidance of the exploitative tendency in the hospital sector. This scheme offers a healthy and just profit to all who engage in the hospital service sector. Thus the no-bill hospital scheme of the Congress assures the continuation of Mahatma Gandhi's vision and tradition. To Mahatma Gandhi there is no need for power to do good for the world. This vision be an inspiration for the rejuvenation of the Congress. The Tata Hospital at Kasaragod will blaze a new global trail for the world. Let us hope that, with the support of generous patrons like the Tata, Rahul Gandhi will be able to show a new way forward for the India and the world.
Let Rahul Gandhi be the hope for the 130 crore people of India and their mass leader.